Okay, thank you very much for your invitation, and I'm very honored to be able to contribute to your policy discussions with our international work on the currently issues that are happening on the ground. And in my presentation today, I would like to focus on starting strong 3. As Andreas mentioned, our business at the OECD includes suggesting solutions, and we have thoroughly researched internationally what policymakers can actually do to improve quality. But before introducing all of the policy levers, I would like to set the scene. Why ECEC matters and why quality matters, which you must know already, but I will briefly go over this. So why does ECEC matter? Well, the starting point for policymakers goes back to the brain research. When the brain research has shown about the most sensitive period, critical period for the brain to be sensitive to learning, then you can see the peaks of the sensitivity takes place before the age of 3 or 4. So that means, which includes kindergartens and also even before kindergartens, which includes care. So more and more policymakers are interested in not only kindergartens, but also what is happening before they enter kindergartens. It can be at home with parents, or it can be home-based learning or community-based learning. Another research that drove policymakers to focus on early childhood education and care is the research from economists. And here's the famous diagram drafted by the Nobel economist prize winner James Heckman. And this practically shows with $1 investment, the same $1 investment, the return to the society at large is the largest in the early years. So these research really pushed policymakers to focus on early childhood education and care. But the problem is, first, children don't have voices. So even, if I go back to this, even though research shows this, children from age 0 to 3 don't really say, oh, I'm so eager to learn. And also, they don't have votes. So it doesn't appeal to the politicians. And another obstacle is this. It takes decades to get the gains. And policymakers are constrained with the political cycle, with the elections, so it's very difficult to implement a long-term policy plan. But we also know that if the quality is not reassured, this will not happen. Research from Denmark and Canada even says if the quality is of low quality, it will not bring positive benefit. It could even bring detrimental, long-lasting effects on child development. So we really need to get the quality right to get this diagram work. This is why we launched a project focusing on quality in ECEC. And we have identified 5 policy levers to improve quality, for which I will go over in detail later. So, the first policy lever is policy goals and minimum standards, which has been already mentioned. And this is at the system level. The second lever is also at either the system level or the program level, which is curriculum. So Andreas has mentioned that the curriculum is kind of the focus in the past, but it still is important because it can support workforce. So this is what is happening at each program. Another one is family and community engagement. Many citizens often expect the ECC centers to do all the work, but research does show that what is happening at home is equally or sometimes even more important for child development. And also communities, neighborhood. If children are living in the dysfunctional families or dysfunctional communities, it really needs a strong state intervention. Finally, data monitoring and research that can take place at the program level or the system level. So, Starting Stone 3 includes 5 action areas for each of the levers. One is, what does research say? Because sometimes child-related discussions are often emotionally oriented, and we lose track of it. So it's very important to design research-based, evidence-based policies. So what does research say? The second, what do other countries do? So many countries wanting to know the international overview. Third, many countries also wanted to know what are the challenges other countries are facing and how are they tackling the same challenge we are facing. Of course, we may not be able to adapt the same strategies considering the different context. The fourth area, which countries wanted to know, is the key lessons learned. Okay, we don't want to follow the same track of the failures of the policy, so we want to know what to avoid, what to do. The last area is a self-reflection assessment. OECD is often seen as an organization which tells countries what to do. So don't tell us what to do, we know what to do, but just give us some food for thought, that's enough. So we try to accommodate country needs, and we try to cover all of these 5 wish lists. But in my presentation, due to the limited time, I will only focus on the first 3 areas for each of the 5 policy levers. Okay, now the first policy lever is quality goals and minimum standards. What does research say? Well, research says setting out clear policy goals can help consolidate political will. Without strong policy statement, it's very difficult to support it. And with the strong political will, policymakers can strategically align resources with the priority areas. And it is not only for the policymakers, but having the shared quality goals, it builds consensus among practitioners and policymakers. And it can also contribute to even the level of quality provision. And minimum standards sounds very bureaucratic, but actually it is also for the providers too. It can level the playing field, and it can also help parents to make informed choices. And of course, it is for children as well to ensure the minimum level of health, safety, learning, and well-being, a quality environment. And it can also support transparent regulation of the private sector, especially in countries where the private sector is dominant, which is not the case in some of the OECD countries. Now, what is the international overview? We have series of graphs, but this is just one example of the minimum standards, which is staff-child ratio. Staff-child ratio is more important in early years than in later stages of life. And as you can see, it varies across OECD countries. And it is important to have fewer number of children per staff, but at the same time, research also shows that the peer learning is important. So setting a too high level of quality is not necessarily good, and it's also costly. And what are the challenges and strategies? I picked only one example, which is the dilemma for all OECD countries which participated in Starting Stone 3, which is securing financial means for quality enhancement in ACC. it has many competing objectives within ECC sector for access and also across different education levels, primary education, higher education, adult education, and so on. What strategies do countries take? Well, one example is to link quality standards to public financial funding. This strategy is mainly taken by many Anglo-Saxon countries, like the US, some states from the US and some provinces and territories of Canada. Another example is using international country examples to inform regulations and standards, which was reported by Australia and New Zealand. So before discussing what is the optimal staff-child ratio, what is the optimal space per child, instead of starting domestic discussions, they try to see what's out there. And I consider this conference is part of this. So I would like to congratulate you with the good starting base. And there are many others, which is including Starting Stone 3. Now, the second focus is curriculum and learning standards. What does research say? Research says that the curriculum and learning standards can ensure an even level of quality across different sectors and programs and across different practitioners. And it can also reinforce positive impact on child learning and development. But again, curriculum may sound bureaucratic, but if the curriculum is written in an easy word, then it can actually help staff and parents. And that was reported by Australia when they redesigned curriculum. They made sure that the curriculum is not going to be a bureaucratic paper, but this can be used by everyone. So it can support staff on how to enhance children's learning and well-being, and also parents can actually learn what children are doing in centers. And also it can guide parents on what to do at home. Because later I'm going to talk about this, but home learning environment does have a long-lasting effect, and that was verified by the PISA at age 15. Here, after reviewing international research, we could not solve an issue, which is a most frequently researched question: whether academic approach focusing on literacy numeracy works better, or a comprehensive approach including health, environment, and socio-emotional development works better for child outcomes. But it all depends. It all depends how you define child development and child outcomes. And this is similar to whether to take teacher-directed approach or child-initiated approach. And I just want to introduce you one research finding, which is a mapping exercise of the available research. And this shows what kind of child outcomes, which is on the from you, left side, and whether you take academic approach or comprehensive approach. As you can see, both does have positive effects, but on different outcomes, such as IQ scores with academic approach, whereas creativity more with comprehensive approach. Now again, one example of international overview is a content area. What does curriculum include? And it was interesting to compare internationally. As you can see, literacy, numeracy, physical education, science, and arts, they're all included. And play was an interesting response from many countries. On this scale, play is much less than numeracy and literacy, but actually countries said, well, this is not a relevant question because play is already embedded in every subject, so it's not a separate subject. So with these remarks from all these countries, play is the key element for early childhood education and care, and this has been again found with the New Zealand longitudinal study how play is important to boost creativity in children. And also another finding from this mapping is that the curriculum of early education can be aligned with the school curriculum, which we learned from countries' responses such as learning approaches and ICT and foreign language teaching. So these countries said, well, these are included in line with the school curriculum reform. So some countries really see curriculum reform not as early education, but as a child's continuous development. Now, what kind of challenges and strategies? As I said, ensuring continuous child development is a challenge for many OECD countries because it has been like a sector-oriented approach to look at curriculum. Now, strategies. Adopting a unified curriculum for care and early education is one of the commonly taken strategies, especially by Nordic countries and also Anglo-Saxon countries as well. And a new trend is going beyond early childhood education and care, going beyond until primary education and sometimes secondary education. So some countries do have a curriculum framework from 0 to 8 or 0 to 10, or some countries even have 3 to 18, which is in Ireland. Another example is aligning curriculum with broader quality goals and assessment practices. Again, embedded curriculum into different ways to ensure child development. Again, this can be found in Ireland. The third one is workforce. And I must say, reviewing all the literature from international knowledge base, workforce really matters. The research says qualifications, education and training, they really determine staff's pedagogical quality, which will influence child development through staff's knowledge, skills and interactions. But then what does it mean, pedagogical quality? Research has detailed that high quality staff has good initial education and also continuous professional development. And they do have good understanding of child development. As Andreas mentioned, how children learn, how each children learn. And all of these detailed information about child development is important. And it's not about the knowledge about child development, but also knowledge about curriculum elements is important to implement the curriculum. Curriculum design is one thing by policymakers, but unless it is implemented, it is just a paper. And from our review, we found out that some of the staff, in some countries, many of the staff or practitioners didn't even know that there was a curriculum reform. So they continued with what they have been doing. Another one is not about the knowledge, but actual skills and abilities. Ability to praise, comfort, question, and elicit how children can connect ideas and scaffold, be responsive, and stimulate development. So this is important skills. The skills needed for staff is not only about the relationship with the children, but also skills for problem solving and development of lessons. This is more about managerial skills. And it's not only about managerial skills, but it's also about strong leadership. Leadership of each individual practitioner and also kindergarten owner, the school leader. Now, concept. What does it actually mean to each practitioner? And available research has identified at least 6 components of working conditions. One is high staff-child ratio and low group size. Sometimes practitioners are thrown into a classroom or center environment where there are so many kids. So this is considered as a poor, a good working environment, which does have impact on ECC services as a whole. The second is, of course, wages and benefits, salaries, remunerations. Third element is reasonable schedule and workload. 4, low turnover rates. And 5, this may be relevant to this group, is stimulating a playful physical environment. The research has shown this is not only for children, but for staff working in that environment as well, as part of the working conditions. And 6th element is competent and supportive center manager, which plays a key role again. So all of this does have positive impact on the quality of ECC services. And what about for children? Well, research has found for element 1, 4, it's clear this does have positive impact for children. And for 2, 3, 5, 6, it is unclear. It does not mean it does not have an effect, but research is lacking. So research should be advanced to identify whether there are effects or not. Now, international overview on qualification levels. What we found that there is a big gap between staff working in kindergartens and childcare staff. For childcare staff, the average is ISCET level 3, that means secondary education, upper secondary, whereas in kindergartens, more than half of the OECD member countries have the qualification of ISCET level 5, that means university qualification. And one of the challenges is workforce retention. As I said, high staff turnover rate is detrimental for child development. So many countries are taking different strategies to tackle this. And one of them includes improving salary, minimum wage, and benefit. It is easy to say, but once again, it has many competing objectives. And in Australia, for example, they have taken a more inclusive approach. They formed a multi-bargaining arrangement. So it's not only the child care sector, but also other sectors who are suffering from the minimum wage are gathering together to bargain for it, for example. And monitoring working condition is the starting point to make an argument, evidence-based discussion, not just saying that we need better working conditions. And this was reported by Chile, for example. Now, the fourth element is family and community engagement. As I said, it's not only the center, but also what is happening at home really matters. And research has said the family and community engagement can actually make services more responsive to what children need and improve ECC quality and improve home learning environment. And home learning environment includes both physical and the number of books, and also parents' habits, whether they read at home, read stories at home at an early age, and so on. And the number of vocabulary and types of vocabulary really improve the child's vocabulary, which was reported by the British longitudinal studies. Another element is ensure continuity of child experiences in different environments. And this includes the transition from home to centers, centers to primary education, home to primary education, and all of this continuity really matters. And also inform parents and communities about child development is as much as important as how staff needs to be informed of child development. And there are different ways to engage parents. And the typical ones can be categorized in 5. And interestingly, many countries, which is on the right, make it as an obligation that parents should be the first priority of being responsible for child development. But actually, some countries emphasize it's not only the obligation, it's a right. So they stress the importance of the positive aspects and putting it policy paper and involving them in decision making and allowing parents to be the provider at different ways. And one of the key challenges is lack of awareness and motivation to be involved. So many countries engage parents in developing curriculum, so don't let researchers and government officials design curriculum, but get them involved and evaluate ECC services and have them volunteer. So very briefly, the last one is data, research and monitoring. The research says data, monitoring and research itself actually helps to establish facts and improve accountability and improve program quality. And internationally, it's interesting to see what is being monitored for quality. And there are many aspects, at least there are 7 aspects, including child development, staff performance, and quality of the service, parent satisfaction, and so on. So due to the time, I will skip quickly. And also it's interesting to see what monitoring methods are being used. It's not just the compliance check and inspections, but also observation, standardized testing, checklist, portfolio, rating scale, and so on. And frequency of such monitoring also varies across countries. And finally, one of the key challenge with the data is lack of data to begin with and information on the quality of ECC services. And there are many ways the countries attempt to improve this, and one includes embedding data collection on structural quality indicator aligned with the national quality goals, which is a new international trend which can be seen in the Netherlands, Nordic countries, US, UK, Australia, and so on. And this is one way, publishing. A more down-to-earth approach is publishing quality reports on a regular basis by the centers themselves and communicate quality, which is taken by Nordic countries like Sweden, for example. So this is just an overview of all the issues. I hope it made sense. And thank you very much once again for letting the OECD to share with you the international overview. Thank you.